Well, chances are pretty darn good you have had back pain, you do have back pain, or you're going to get back pain. So what can you do to prevent it or get rid of it? Dr. Saeed Monterey is Revive Physical Therapy and Wellness, and he's here to help you get some of the relief that you have been looking for. First of all, I'm so glad that you're here in our studio.
I'm glad to be here.
I don't know anybody who has not complained of back pain before. So we're talking low back pain and sciatica, but what's the difference?
So with low back pain, you're going to have pain more just in your low back, in the lumbar region.
Okay.
When we're talking about sciatica, now we're talking about nerves involved.
Okay.
That nerve's being pinched from your low back that actually travels down the leg, and then you get symptoms, burning, pain, numbness in the leg, but it's actually coming from your back.
Okay, so when you feel sciatica pain, it's shooting down, or pain shooting down your leg, that's basically sciatica. That's just like one step worse than just having low back pain.
Yeah, where low back pain is just in the back.
And what nerves exactly are we talking about, that feeling?
So yeah, let's familiarize ourselves with the spine a little bit. So this is the low back, and these are the nerves that are coming out of the low back, out of the canal here. Now, if these nerves are irritated or pinched, these nerves travels down the leg, and that's when you can get that sciatica. Now that can happen through either a bulging disc, a herniated disc that's being pushed out and pinches the nerve, or spinal stenosis, which is narrowing of that canal, of that passageway.
Okay.
And when that narrows, that can pinch the nerve.
Okay, so you're starting to feel some of that pain. Come on over here with me, because we have a couple of your actual therapists who have agreed to join us here on the table. They're doing right now a treatment. When somebody comes in to see you for low back pain, this is where it all begins. So tell me what's happening here, and what
so right
what
now,
are we treating?
let's say a patient's coming in here and it's the disc that's aggravated the nerve. And a lot of times they have pain with bending over or sitting. So right here, we're going the opposite direction. We're extending her back. And what this does, this helps push that disc. If I grab this, it helps push that disc away from that nerve. So if I'm going here, open it up, so that disc is not pushing down into that nerve, or pushing it away.
And for what would you be treating? The stenosis or there's three different things.
Yeah, this would be for the disc.
For the disc itself.
That's pushing it to get that off the nerve.
Okay, and this is obviously, we've talked about this very extreme that we're seeing, and this is something that you work up to.
We work up to, we work up to see what that patient can do, What
is the next treatment plan that you would do?
The next one would be for stenosis.
And stenosis is exactly what again?
Stenosis is that narrowing of that area right here.
Okay. And this
so
is
what we're looking
completely
for,
different.
Yeah, so even though you might have the same symptoms, the causes are different, so they have to be treated differently.
Okay.
Here we're looking at getting that tilt to open up that spine.
Okay.
So if I grab this spine model here, so we're looking at rotating that pelvis back. And you see how that opens up that disc there.
Yeah.
Or that's canal.
All up in here. Okay.
So that opens it up, and then we're engaging the muscles, because the muscles are important to relieve that pain as well.
And the third treatment you would do would be for?
For spinal instability.
Okay.
And that's basically an imbalance within the spine. The spine isn't balanced. One part of the spine moves too much compared to another one, and the muscles aren't working. So here now, we're really challenging those muscles to fire. Alyssa has to work hard to stabilize that back as she's moving her legs, and Dalton is trying to force that back to move.
I have to tell you, when we were like going over this earlier, and I said, oh my gosh, Alyssa, get off that table. I got to try that. It felt so good.
Patients get a lot of relief.
Oh, just watching it. If you have low back pain, just looking at this, you're like, oh man, that has got to feel good. But and very quickly, very important is the home treatment plan that you give people.
Exactly.
They have to do that.
They have to, because then we teach them just simple movement patterns that also they can get relief at home. And then we also use hands-on treatment to get even more benefits at the clinic.
It's part of a program. It's going to help you avoid surgery, medications, all kinds of things. Also, Dr. Saeed, thank you so much. Really good information. Let me give you some information now. If you're suffering from low back pain or sciatica, this is for the first 15 callers who call in. Dr. Monterey is going to give you a free pain evaluation and a home treatment plan, and they'll also do a courtesy insurance benefit check to see if you want to continue your treatment and make sure that it'll be covered by your insurance. Revive Physical Therapy and Wellness is located at 4703 South Lakeshore Drive. That's suite number 2 in Tempe, 480-718-9493 to make an appointment for your evaluation. Learn more at reviveptandwellness.com.